So, what is a stroke? A stroke, sometimes called a brain attack, happens when one of the arteries of the brain becomes blocked. So a lot of us have probably heard of a heart attack. A heart attack happens when one of the arteries of your heart is blocked, right? And that causes some crushing chest pain, maybe some numbness or pain of the shoulder. Stroke, similarly, is a blocked artery, but of the brain. And the symptoms of a stroke are quite variable. So the presentation of a heart attack is usually chest pain like we talked about, but what happens in a stroke, the symptoms depend on which artery of the brain is blocked. Right. So these are the signs of a stroke. Has anyone heard of this memory tool before? Be fast. We have 1, 2 maybe. Okay. So Be Fast is a memory tool that was developed by the American Heart Association to help us remember what are the signs and symptoms of a stroke. And there is going to be a lot of repetition of Be Fast because I think that's the most important take home of today's talk, is really nailing down these symptoms. So bear with me, we are going to go over this a few times, okay? So Be Fast. Stroke happens all of a sudden, right? Stroke happens, like I said, when an artery is blocked, and that blockage happens quickly. So 1 second I'm fine, and then the very next second I've developed one of these symptoms. I'm not talking about, so the first one, for example, is balance. As we get older, a lot of us sometimes will develop some issues with balance, right? We might need some assistive walking devices, might feel a little unsteady on our feet, but those are things that happen gradually over time, as opposed to a stroke, which is a blocked artery leading to very severe balance symptoms all of a sudden. So all of the symptoms we're talking about, these Be Fast stroke symptoms, I was fine this morning, I had my breakfast, and then at 11 a.m. all of a sudden, very imbalanced. That would be more concerning for a stroke than something that gradually happened over time. Does that make sense? Stroke is all of a sudden, okay? So signs and symptoms of a stroke. B is for balance. I was walking and then all of a sudden the room is spinning. I feel really imbalanced, unsteady on my feet. E is for eyesight changes. So went to bed last night, my vision was totally normal. I woke up this morning, all of a sudden I can't see on one side of my body or in one of my eyes. That is concerning for blocked artery in the part of your brain responsible for vision. So all of a sudden eye changes. F is one that most people are familiar with, right? Everyone has learned this stroke symptom of face droopiness. So face droopy. A is for arm weakness, all of a sudden weakness in one arm. S is for speech. So if all of a sudden I'm having trouble getting my words out or my words are becoming slurred, that would be concerning for maybe a stroke symptom, okay? And then T is the really important one, which is time to get help, time to call 911. And we'll talk about why. All right, so these are the Be Fast symptoms, and now we're going to try them together, okay? All right, you can go ahead. Thank you. So B, who remembers what B was for?
Balance.
Balance, very good. Just keep going. Let's see. Perfect. E was for? Eyesight. Excellent. F?
Facial droop.
Facial drooping, good. A? Arm weakness, excellent. S? Speech, good. And what happens with the speech? Slurred, or I'm having trouble finding my words, right? And then T, we said, was really important, is time to call 911, that's right. Okay, bear with me, we're going to repeat that a couple of times. Next slide, please. All right, so did you know that 80% of strokes are preventable? Next, please. That means that there's things that we can all do collectively to reduce our risk of stroke, okay? Next slide, please. All of this is taken from the latest 2024 guidelines. This was a joint effort between the American Heart Association, neurology boards. You can find this online if you have a lazy Sunday afternoon. It's about 200 pages. You can read through all of it. But these are all the latest guidelines and data we have for how to protect ourselves from stroke, okay? Next slide, please. All right, so what are my risk factors? These are the 5 common risk factors. I'll block it for a second. So does anyone know what are some risk factors for stroke? What can you think of? High blood pressure, certainly. Smoking, absolutely. Diabetes, good. The diet, absolutely. Associated with high cholesterol, good. Anything else? Smoking, good. Alcohol use, definitely not one that people often think of, but can cause strokes. Stress, definitely, right? A lot of stress in your life. Stress leads to things like high blood pressure. So high blood pressure is one of the main symptoms. What else? Those are the... Too much what? Too much sunshine. I haven't found that in the guidelines, but we'll have to keep an eye out. Yeah. Anything else? Good. So those are the 5 main ones, right? So we want to think about high blood pressure, diabetes, smoking, high cholesterol, and then also excessive alcohol consumption. And we'll talk about why. There are other things, certainly, that can cause strokes, right? A lot of us might have heard about a heart condition called atrial fibrillation, where the heart is beating irregularly from time to time, and that causes little blood clots to form that can then shoot into the brain. But we're not going to be speaking about every risk factor for stroke, just the 5 main ones today, okay? All right, so high blood pressure, next please. Ways to reduce my risk, next please. So things you can do, lower your blood pressure. We'll talk about what that might look like, next please. Okay, blood pressure. So this is a funny cartoon. Once we finish with your blood pressure, we need to find out why your arm is purple, okay? We've all experienced this, right? Next please. So high blood pressure is the #1 risk factor for stroke and heart disease. Next, please. If your blood pressure is too high, why is that a problem? What happens over time? Does anyone know? What was that? Arteries, yeah. So the arteries of your brain, of your heart, and of your kidneys respond to high blood pressure by narrowing over time. They don't like to be exposed to that really high pressure in the arteries, and so they narrow. And they develop a lot of junky looking plaque within the arteries. Over time, that can lead to what we're concerned about, which is complete blockage of the artery, causing a stroke. Okay? Next, please. How do you know if your blood pressure is high? You have to check it, right?
Very boring.
Very boring. That is very true. I'm sorry. But it is very important. So how often should you check your blood pressure?
Twice a day.
Once a month is great. Yeah, I think that's a good...
If you're on medication.
It's true. So everyone is different, right? If you're on a lot of blood pressure medicines, or your doctor has asked you, hey, let's keep a close eye on your blood pressure, I want you checking it every day, that's great. But for the most part, we should be checking it around once a month, seeing what our numbers are like. When you come to my office and we check a blood pressure in the office, I can guarantee you it's not accurate, right? You were running late, I was running late, you forgot your water in the morning, you just had your coffee, right? The blood pressure is never accurate. So the only way for us to tell what your blood pressure actually is if you check it on your own, right? So if you're checking it at home, in your normal environment once a month, or at the local pharmacy, and write those numbers down, that's a lot more accurate than when you're in the office, okay? Next slide, please. Thank you for doing this, by the way. So what is the target blood pressure? Does anybody know what the goal is? 120, 130. The most recent data suggests 130 over 80 is the good number to target, okay? I'm sorry? Need to make up your mind. It is an excellent point. It is true. It is true. You're very much correct. But keep in mind, this is a recommendation across the board around 130 over 80. Every patient is different. It depends on how do you tolerate blood pressure medications? What other medical conditions do you have? And so this is a discussion between you and your doctor, but on average, we look for a number of less than 130 over 80. You want to prevent those arteries from becoming narrowed, right? Next slide, please. All right. What about diabetes? What is diabetes?
Blood sugar.
Blood sugar is too high, right? Sometimes that happens when we're very young, called type 1 diabetes. Sometimes it can happen as we get older, called type 2 diabetes, meaning the pancreas just is burning out a little bit, not producing as much insulin. And so our blood sugars go up. What happens if your blood sugar is too high? for too long. You could have a stroke, yeah. Same thing as high blood pressure, right? The arteries don't like that sugar. It's inflammatory. It causes plaque to build up in the arteries. They narrow over time. Very good. Next slide, please. So how do you control diabetes? Well, how do you know if you have diabetes, first of all? Get it checked. Good. And how do you get it checked? How do we check for diabetes? Okay, good.
Should keep you in business.
Yes, it's all up to us. Yeah, definitely. Okay. A1C. Has anyone heard of an A1C before? Yes, very good. A1C tells you how high has my blood sugar been over the past 3 months on average, right? It's a new test, so it's not just checking my finger stick glucose right in this moment, but it's my average over the past 3 months. Yeah. Borderline, yeah, good. So there's something called pre-diabetes, right? Where, oh, your numbers are creeping up. Time to take this a little more seriously, right? So how can you lower those numbers, making sure that the arteries aren't getting inflamed from all that sugar? Exercise, weight loss, of course, and then ultimately some of us do need some medications.
And what about the food?
The food, we'll talk about that too. Yeah, good. Next slide, please. Yeah, so we'll talk about diet in a second, and we also have a cookbook that Marianne put together with a lot of really great recipes for people who might have diabetes or high cholesterol that we can talk about.
Mm-hmm.
Yeah.
Having a string enough for cake and desserts.
Yeah, there's some desserts in there, right? We'll check. We'll double check. All right. What about smoking? So we all know that by now, right, smoking tobacco, nicotine, all of that, very similar to blood pressure and diabetes, causes inflammation of the arteries. They narrow over time. A lot of junky looking plaque. So the best way to stop smoking, or the best way to prevent this from happening, is to stop smoking, right? Easier said than done. But in 2025, we have a lot of new tips and tricks. We have nicotine patches, nicotine gum, there's therapy services, there's a new medication called Chantix that is very helpful for some of the cravings. So if anyone, friends or family, yourself, still smoking, now would be a good time to talk to your doctor about ways to quit, right? Okay, very good. Next, please. Cholesterol, next, please. Okay, very good, cholesterol. So who here has heard about cholesterol? Good, okay. All have heard about it, okay, good. So cholesterol is the fat that circulates in your blood. It's very important for a lot of various factors, but when it's too high, same thing as diabetes, blood pressure, and smoking, it accumulates within the arteries of your wall and can cause damage and narrowing, okay? Next, please. There are two types of cholesterol. Has anyone heard of these two types? LDL and HDL? Ringing a bell? Okay, so you want your LDL to be low, and you want your HDL to be high. It's pretty simple, right? L and H, low and high. Okay, next please. This might help you remember. The LDL is bad, and the HDL is good, okay? Because it can build up in your arteries over time. So what are some ways to lower cholesterol? Diet. That's often the number one answer I hear is diet. Good. What else? Medications. Like what? Okay, good. That's blood. Yeah, what's like the most common cholesterol medicine that people have heard of? The statins, right? Everyone's heard of the statins, the atorvastatin, the simvastatin, the Lipitor, the statin medicines. So diet, medications, but the most important one and the best way to reduce your cholesterol is? Exercise. Very good. Excellent. Exercise. Okay, good. Next slide, please. So how to lower your cholesterol. My doctor told me to watch my cholesterol. So now I stare at my French fries for a few minutes before I eat them. Next slide, please. So lifestyle choices. It's never too late to lower your cholesterol. We know that even when you're 75, 80, 85, 90, even if you lower your cholesterol a little bit, it still can help protect the heart and the brain from some of these things we're worried about. Next, please. So one thing I didn't mention, we talked about it earlier, getting enough sleep. Okay? Getting enough sleep. 7 to 9 hours is the average recommendation. Everyone is different. If you are sleeping 6 hours and you feel well rested and energized during the day, great. But if you're sleeping 6 hours and you're feeling fatigued and tired throughout the day, might be something to talk to your doctor about. How can I improve my sleep? A lot of us, as we get older, have urinary issues that need to be addressed, right? Snoring and sleep apnea that need to be addressed. So improving your sleep to get 7 to 9 hours is recommended. The number one way to reduce your cholesterol. Move at least 20 minutes per day. Who here is moving at least 20 minutes per day? We're trying to, right? It's tough, easier said than done. Particularly this year in New York has been brutal weather-wise, right? It's really hard to get out for a walk, but something that we should definitely try to incorporate. If you can get out for a walk, if you don't have any mobility issues, doing a walk for 20 minutes a day can lower your cholesterol by 20 to 30 points. Yeah. Spine issues. It's exactly right. It's exactly right. It's a great question. The question was, hey, I've been recommended, or I hear a lot that I'm supposed to be walking 20 minutes a day, but maybe I have spine or hip issues that prevent me from doing that, right? It's a great question, easier discussed than actually done anything about, but physical therapy is a good first bet, right? So asking your doctor for a script to see a physical therapist, to see what kind of cardiovascular exercise can I do given my limitations. They can maybe get you on the treadmill, a stationary bike, do some stretching, to see what works best for you, and then try to incorporate that day to day, okay? Very good. Next, please, eat healthy, Mediterranean diet. So I heard diet a lot. Who here has heard of a Mediterranean diet? Wow, that's excellent. Very good, very good. So what is a Mediterranean diet?
Red wine.
Red wine. No. Yeah, red wine, good. Fish, okay, good.
Vegetables.
Huh? Vegetables, good. Variety of vegetables, fish, white meats, beans, legumes, all that good stuff. Next slide, please. This is what the Mediterranean diet looks like, right? So things you want to eat with every meal include things like fruits, veggies, whole grains, extra virgin olive oil. Now, what type of fruits are we talking about when we say fruits? We're not talking about the fruit juices. We're not talking about the fruit cups, right?
No, it's fiber fruits.
Fibered fruits, exactly. We're actually not even talking about the delicious summer fruits. So the watermelons and the cantaloupes that we all love, we're talking about the fruits that are high in fiber. So things like strawberries, bananas, apples, all of those are excellent, okay? But not all fruits are created equally, so keep that in mind. At least 3 servings per week, things like fish and seafood, nuts, beans, limited to 1 serving per day of dairy and eggs, and then very limited red meat and sweets. Now this is of course perfect, right? But we don't live in this perfect world. But I think as long as you can incorporate more legumes like beans, more high quality fruits and vegetables into your diet, the better. You can't have nuts? Yeah, a lot of people can't have nuts for digestive issues and other reasons. So I think focusing on the other things in that category, right? Yeah, that's tough. Yeah, I think it's a great question, but trying to focus on maybe the other food groups in that category, the foods in that category would be helpful. So high fiber, vegetables, fruits, etc. Okay? Now I heard red wine. We'll address that, yeah?
Chicken and fish and stuff is how you do it. Take it, you roll, you fry it,
That's exactly right. Did everyone hear that? The way you process and cook your food is also important, right? And so the same way that we said that all fruits and vegetables are not created equal, the same is true for the meats that you're cooking. If you're cooking them in extra virgin olive oil, excellent. But if you're deep frying them in lard and all sorts of butters and things, it limits the nutritious value a little bit, okay? Still better than eating processed, rapid fast foods, right? Still better to eat that yummy food. Next question I have, what about salt? We've heard a lot of bad things about salt, right? But I'm going to take that information and put it aside for now, okay? Salt is not the enemy. If you have very difficult, very elevated blood pressure, or if you have a condition called heart failure, where your body stores and retains fluid, then salt becomes tricky. But if you are not someone who has heart failure or really elevated, difficult to control blood pressure, then salt is a great additive to vegetables and seafood and chickens to make them taste better, right? It is much preferable that you eat salted broccoli and asparagus than something without salt that's horrible for you, okay? So I tell people, go ahead, sorry. You can't, I'm sorry?
With no iodine.
Oh yes, iodinated salt, yes. So that's another good point. So very rarely some patients who have thyroid issues can't have too much iodine, which is a good point. But I will say that if you're not one of those patients, you can lather your food in salt and oils and make them really tasty and yummy as long as the foods you're cooking are healthy for you, right? We're wrapping up, so let's do this one more time and see where we landed, okay? So be fast. The B was for?
Balance.
Excellent. E was for?
Eyes.
F?
Facial group.
Face. A?
Arms.
Arm weakness. S was? Speech. And T?
Time to call 911.
Time to call 911. Excellent. Very good. Thank you. I think there's maybe a couple more slides. Okay, so we're wrapping up here, but I want to talk to you about what happens if you have one of those BFAST symptoms. What does that look like? So you had a BFAST symptom. Husband has slurred speech and can't move the right arm. So we have two of our BFAST symptoms, the S and the A. Call 911. Good. So what happens if you call 911? So wife recognizes the symptoms of stroke using BFAST. She calls 911. Then what happens? Next slide, please. So she calls 911. The first responder team arrives. Next slide, please. Okay. So this is what happens in most of New York. An ambulance comes. They take you to the hospital. What happens once you get to the hospital? Does anyone know? Are there any treatments available to people who are suffering a stroke?
Yes.
Someone said yes. Yes. I have one yes. Does anyone, are there definitely treatments? We're not sure.
Yes, it is.
Definitely is a treatment. Okay, good. Okay. Yes. So multiple strokes at once. How about if I finish this and then I'll answer that question? Does that sound okay? Okay, yeah, that's a good question. Strokes in different parts of the brain. Okay, very good. So it's all the same. So if you have blocked arteries at once in multiple parts of the brain, you might have multiple of those BFAST symptoms, balance, eyes, speech, face, arm. Still call 911, get to the hospital, because there are two treatments available for people who are suffering from a stroke. One is a clot busting medicine called T and K. Has anyone heard of T and K? Yes, one T and K. Clot busting medicine, so we give in the vein, goes up into the brain and can dissolve whatever blocked artery is there. But we can only give it if you show up to the hospital within a certain time window. We can only give tenecteplase, this medication T and K, if you show up within 4.5 hours of your symptoms starting, right? Which means that you can't call your primary doctor and wait for him to call you back or her to call you back. You can't call your sister in California and wait for her to give you advice. You only have 4.5 hours, right? So you have to get to the hospital so that we can give you this medicine to treat whatever blocked artery you're experiencing and get you better. After the 4.5 hour window, that artery has been blocked for too long, the damage to the brain has already happened, and so we can no longer reverse it once you come, okay? Yes?
What if you feel that you're experiencing a stroke and you take an aspirin?
Ooh.
Does that help and then go to the hospital?
Yes, that is an excellent question. Thank you for asking it. Yeah. What do people think? I am sitting at home, my speech is becoming slurred, my right arm is becoming weak. I'm thinking these are BFAST symptoms. Should I take an aspirin and then call 911, or should I come straight to the hospital?
Your doctor told you do not take aspirin for a certain reason. I'm not going to wait to take an aspirin.
Yeah, it's a good point. The question is, if I have one of these symptoms, should I take an aspirin before calling 911 or coming to the hospital? And the answer actually is no, okay? The answer is no. It's a great question. This is different than what you are taught about a heart attack. If you develop crushing, sternal, chest pain, it feels like an elephant is sitting on your chest, or maybe some arm radiating symptoms, and you're like, this really feels like a heart attack, the recommendation is to take aspirin. However, if you think you have a blocked artery of the brain, meaning balance, eyes, face, arms, speech, the recommendation is do not take aspirin. The problem is that sometimes strokes affect your swallow muscles. And sometimes by swallowing the aspirin ends up in the lung. Okay, so it can cause a pneumonia. So that's the one thing. The other thing is, we've spent all morning talking about ischemic stroke, which is a blocked artery. But there is another type of stroke called hemorrhagic stroke, which is a ruptured artery, bleeding into the brain. You can have the blocking type of stroke or the bleeding type of stroke, and the only way to know is with a CAT scan. The only way to know is what is causing my symptoms. Is it the bleeding or the blocking? Is if you have a CAT scan in the emergency department. So we do not recommend taking an aspirin, because what if you take an aspirin and you can't swallow? Wrong tube. What if you take an aspirin but the actual thing was bleeding? You've now made the bleeding worse. So crushing, chest pain, heart attack, take an aspirin. Be fast symptom concerning for stroke, stay away from the aspirin. Sound good? Excellent question. Okay, yes.
That's the reason why doctors got away from telling you to take a baby aspirin.
Okay, another similar question. Everybody used to be prescribed aspirin, right? 5 years ago.
Baby aspirin.
Everybody was taking a baby aspirin. What we found is that it does not protect everybody from strokes, and it actually causes bleeding in a certain segment of patients. So you really should only be taking baby aspirin every day if your doctor has recommended it. It's not something that we recommend people take every day because of the side effects. Okay? Yeah.
Stroke while you're sleeping?
Can you have a stroke while you're sleeping? What do we think? Yes. It's an excellent question. Yeah. What does it look like? Yeah. Good question. Yes. Oh, a different question. Yes, most patients who are prescribed aspirin should take it every day, 81 milligrams. The question was, can you suffer a stroke while you're sleeping? In fact, most strokes, because of the hemodynamic changes of the heart and brain while you sleep, most strokes happen while we're asleep. Meaning, I went to bed at 10 p.m., something happened while I was sleeping, and I woke up at 6 a.m. with these symptoms. Okay? And if that happens, get to the hospital right away. We will figure out if you are still in that 4.5 hour window for treatment or not. Okay? Now, we talked about 2 treatments for stroke. We've only talked about one treatment, which is the clot busting medicine. There's another one, new, only over the past 10 years. It is Marianne and I's entire job to make sure that if you come to the hospital and you are a candidate for this treatment, that we give it to you as fast as possible. We spend day in, day out thinking about how to streamline this process. It's called a thrombectomy. It is a procedure where we can string a line into the artery of your wrist, go into your brain, and vacuum out the blood clot. It takes about 30 minutes. It's not an open brain surgery by any means. It's quick, in and out, blood clot gone. Sometimes people have a full recovery after this. Yeah?
What about the one that goes in the groin?
Similar. So it can go either in the femoral artery or the radial artery, groin or arm, into the brain.
And I was in your hospital.
Okay, you said there was a...
No.
Yes. So back in the day, this procedure is relatively new. Back in the day, there were a lot of things that would open the skull themselves to try and treat strokes. Not so common anymore. All right, very good. Next slide, please. Make every minute count. So we can only give T and K within 4.5 hours. we can only do this procedure within 24 hours. So there's a very limited time window. So at any time someone comes to the hospital who is having a stroke symptom, Marianne looks at about 20 different metrics to see, 20? No, 10.
No,
Enough. Okay, about 10 different metrics to see, did we do due diligence for every patient? So the firefighter brings you into our hospital. We have to make sure you were seen by a doctor within 5 minutes. You had a CAT scan that was done within 10, 15 minutes. You were seen by the stroke team within 20 minutes. We gave you this clot-busting medicine within 30 minutes. All of this has to happen at a very rapid pace. And every patient, she emails out an email that says, you guys did a good job on this case, or uh-oh, one of these things took too long, what happened? So it's something that we really work on at the hospital to make sure it's perfectly streamlined. So anyone coming in gets these medications as soon as possible because every minute counts, okay? Next slide, please. When it comes to stroke, time is of the essence. Stroke treatments are only effective when given early on. Every minute that goes by, a little bit more of the brain becomes irreversibly damaged. Next slide, please. We know this. Next slide, please. All right. I think this is probably one of the last points or last slide. What should you do if you had a be fast symptom, balance, eyes, face, arm, speech, came, lasted 30 minutes, and then went away? Do you, A, celebrate with a glass of wine, B, next slide please, treat yourself to a massage, or C, seek medical attention? What do we think? Okay. And why? What just happened to you? What is that called?
Mini stroke?
Mini stroke. Good. Excellent. Or something called a TIA. A TIA. TIA and stroke are the same exact thing. An artery of the brain is blocked. A stroke is permanent. A TIA came and went. But if you have a TIA, meaning there was an artery blocked at some point, it means your risk for another one is very high in the ensuing days. So you don't celebrate, my arm is better. You don't get a massage, arm feels great. You got to seek medical attention. We have to find out, why did your artery become blocked, and then we can prevent you from having anything else. You can go on and live the rest of your life. Yes?
Can you explain the mechanism of a pacemaker and the defibrillator? Pacemaker.
Okay.
They put something inside of you, and you then have to put batteries in and all of that.
Yeah, the question was about...
Explain the mechanism of that.
Not quite my specialty. I wish I could. The question was about pacemakers and defibrillators. I unfortunately am a neurologist, so about here and up is what I'm working with. But things in the heart aren't my expertise, yeah. But you know, a lot of people get pacemakers if the heart rhythm isn't beating smoothly or regularly. Sometimes people will get a pacemaker to help keep that blood pumping nicely. If the heart isn't beating smoothly and regularly, you're not getting enough blood to your brain or other organs, you can pass out. You can also have strokes. Blood not pumping nicely leads to little blood clots. So sometimes people get pacemakers to help with that. Yes? No, it's a good question. I was saying earlier that a lot of that data comes from trials that were paid for by the alcohol industry, so it's quite limited. My impression is that one glass of wine, red, white, rosé, whatever it is, they're probably all about the same. Even though we're all kind of taught red wine is the good one, that data is wishy-washy. But I think a glass of wine a day is probably okay. Yeah.
What happens when your heart is a beat? And like cardiologist, you say if your heart, you feel like it's not beating in your beat, but I do feel like it stopped. And I move, I sit and rest a little bit, and it starts beating back.
Yeah, it's a great question. Any sort of heart issues, I recommend you speak to your cardiologist. It does, heart doctor, yeah. Sometimes you'll wear a patch called a Zio patch, which is a sticker on the chest wall, and they'll be able to see what's happening to your heart rhythm.
I go to the X3 of Dr. Shaker. I believe everybody knows Dr. Shaker.
That's good. Well, it sounds like you're in good hands. Okay, next slide, please. Let's wrap this up. Okay, we are going to finish with everyone's favorite new memory tool, things that we're going to teach our friends, our family. We teach children this in elementary schools, and everyone is learning about Be Fast, okay? So signs of a stroke. B was for? I want everyone to yell it, okay? B is for?
Balance.
E is for? Eyes. Good. F is for?
Facial.
Face. Good. A is for? Arm. S is for?
Speech.
Good. And what do we do if we have one of these symptoms?
Time to call 911.
What do we do if we had one of these symptoms that lasted 30 minutes and went away? Yes. Seek medical attention. You don't necessarily need to call 911, but call your primary doc. Make sure you get in right away, okay? Very good. Next slide, please. Thank you very much. That's all, okay?